Alcohol use disorder has heavily impacted men in the past, but data from the CDC shows that deaths from excessive drinking are now climbing faster among women. So for more on this, I want to bring in a CBS News medical contributor, Dr. Celine Gounder. She's the editor-at-large for public health at KFF. So this doesn't shock me because I feel like we've been talking about this over the years. It's been ticking up and ticking up and ticking up. I think the pandemic probably really pushed things. But can you give us a sense of why women have been increasingly drinking more?
Well, certainly the pandemic. We saw a big increase among both men and women during the pandemic. But as you said, there's been this increase among women over time. Some of this is delaying childbirth. So when you're single, when you don't have kids to look after, when you don't have to be that healthy, good example, right? You're freer, frankly, to drink more. So that's certainly a factor. Women are also dealing with increasing levels of stress, even if they don't have kids, between juggling family, could be caregiving for older parents as well as work. And then there's been a concerted effort to market alcohol to women, sort of the rosé all day phenomenon, the pinking of the alcohol industry, we call it.
I was telling you that a friend of mine during the pandemic had said to me, I think I need to stop drinking so I don't have to stop drinking. She could feel herself kind of coming closer and closer to the edge. And I think when we think of excessive drinking, we think like Elizabeth Taylor and Who's Afraid of Virginia Woolf, just sloppy, angry, drunk. And that's not how it always looks. Do you think that is a contributing factor, too, that people might not realize that they're maybe getting to the point where they should really scale back?
There are a lot of us that are functional alcoholics, both men and women, where it doesn't seem like there's a problem until you hit that point where there's a problem. In terms of physical symptoms, nothing may be obvious again until you've really done damage to your heart, your liver. It could be very subtle, like just an increase in your blood pressure, which you may not even realize is due to the alcohol.
We now know that there is no safe amount of alcohol. And we all like to think, oh, maybe one glass of wine a day, the red wine's good for you. We now know nothing. It's not good for you.
There is no safe level.
Right. Yeah. And I'm wondering, though, does alcohol affect women's bodies differently than it does men's bodies?
Well, it does. We're smaller. We metabolize alcohol differently. And so less alcohol can cause damage to women than it would for a man.
And so how do you know you have a problem?
Well, there are a couple questions that we ask. Have you ever felt the need to cut back on your alcohol drinking? Has anyone ever been annoyed with you for your drinking? Do you ever feel guilty about your drinking? And then probably the most severe symptom would be, do you ever need an eye opener first thing in the morning? But the first three, I would say, are the ones that you should focus on because those are more subtle signs of having an issue. Culturally, the way we sort of I guess we're more accepting of drinking than we have been sort of ever before. And you talked about the marketing towards women. What have you seen? And I guess what have you seen even in your own practice in terms of women and drinking? Well, I think it becomes a way to deal with stress.
Yeah.
I think there's, even if a woman's a mom, sort of this idea of mommy needs a drink.
Yes.
Right? So I think that certainly has become more and more acceptable. You see all kinds of memes on social media, which normalizes the behavior, right?
Yeah. Yeah, I mean, I have to admit, I've giggled a few times.
Right.
I've probably shared a few of them because they are funny, but it's a really good reminder that alcohol, I mean, it's a poison. I hate to rain on people's parade. I like a drink too.
So it's something we don't want to acknowledge.
Yeah.
Yeah.
Dr. Celine Gounder, thank you very much.